Welcome to myeyecademy.com. I'm Professor Mahfooz from Pakistan. In this video, we MCQ 9.1 will discuss the MCQs regarding lens. A patient has decreased vision for last 10 years with the vision of hand movement positive. On examination, the lens has turned white with the normal reacting pupil. The condition is. So concentrate on 10 years, so it's a progressive condition. Lens has turned white, so points out towards cataract, and normal reacting pupil means the optic nerve is normal. So condition can be fourth most common cause of blindness, fifth most common cause of blindness, second most common cause of blindness, third most common cause, or the most common cause. So remember, cataract is the most common cause of blindness in Pakistan and worldwide. So answer is number 5, the most common cause of blindness, which is cataract. Most common cause of blindness is the answer. Next MCQ. A patient has decreased vision for last 10 years with the vision of hand movement positive. On examination, the lens has turned white with normal reacting pupil. Most common etiologies. So we can guess from the MCQ that this condition is cataract. And the most common etiology: advancing age, diabetes, hereditary, topical steroids, or trauma. If you study the section VHP 9.1, that will explain the answer. All these can cause cataract, but the advancing age is the most common cause of causing cataract, so that would be the answer. Advancing age is the answer. Next MCQ. A lady has a decreased vision for last 6 years with the vision of hand movement positive only. On examination, the lens has turned white with normal reacting pupil. The most likely treatment is. So we know the condition is cataract. So what is the treatment of the cataract? Iridotomy? No. Laser treatment? No. Medical treatment? There is no medical treatment for the cataract. No treatment is not the answer because you have to treat the patient. Surgical treatment is the most likely answer because that is the only treatment for the cataract. Let's see. Surgical treatment is the answer. Let's study this slide before going into the more MCQs. Two types of cataract extraction: extracapsular and intracapsular cataract extraction. In the extracapsular cataract extraction, concentrate here. Anterior capsule is taken out, then the lens comes out, but we leave the posterior capsule behind, and on the posterior capsule rests the implant or intraocular lens. In the intracapsular cataract extraction, concentrate here. The whole lens along with the anterior and posterior capsule is taken out, and the types of intracapsular extraction are intracapsular extraction and lensectomy. So extracapsular cataract extraction is without capsule, leaving posterior capsule, while intracapsular cataract extraction is leaving no capsule. With this knowledge, let's do the more MCQ. Next MCQ. The patient has been diagnosed having cataract. Extracapsular cataract extraction involves removal of the lens with anterior and posterior capsule, removal of the lens with the posterior capsule, removal of the lens with anterior capsule, removal of the lens without anterior and posterior capsule, and removal of the lens with the vitreous. So from the knowledge we already gained, extracapsular cataract extraction, this is the lens and this is the nucleus. We remove first the anterior capsule and then the nucleus. So it involves removal of the nucleus with the anterior capsule. So removal of the lens with the anterior capsule will be the answer. And removal of the lens with the anterior capsule is the answer. A patient has to go under cataract extraction. Non-complicated extracapsular cataract extraction involves putting implant. So where you have to put the implant in. Behind the posterior capsule, there is no such condition. In front of the anterior capsule, no, because you have to take the anterior capsule off. In front of the posterior capsule, that may be the probable answer. In front of the iris, that doesn't happen in a non-complicated extracapsular cataract extraction. In the vitreous cavity, that never happens. So in front of the posterior capsule would be the answer. Let's see. In front of the posterior capsule is the answer. A patient has decreased vision for last 10 years and diagnosed as having cataract. Type of intracapsular cataract extraction is iridotomy, lens aspiration, lensectomy, manual small incision cataract surgery, or phacoemulsification. Phacoemulsification is a type of extracapsular cataract extraction. Manual small incision cataract surgery is a type of extracapsular cataract extraction. Iridotomy is not a type of cataract extraction. Lens aspiration is a type of extracapsular cataract extraction. So we are only left with the lensectomy. Lensectomy is one of the types of intracapsular cataract extraction. Let's see the answer. Lensectomy is the answer. Let's study this slide before going into the more MCQs. 9 steps of extracapsular cataract extraction. Incision is the first step. Viscoelastic injection is the second step. Capsulotomy is the hole in the anterior capsule. Hydrodissection is separating the nucleus from the capsule. Lens extraction is removing the nucleus. Irrigation and aspiration is removing the cortex. Viscoelastic injection to keep the eye formed. Implant is implanting artificial lens, and finally is the wound closure. You can see these steps in more detail in video VHP 9.2 and 9.3. Now let's go to the MCQs. In extracapsular cataract extraction, hydrodissection is done. Hydrodissection is done to do what? To remove the anterior capsule, to remove the posterior capsule, to separate the lens from the capsule, separate the lens from the vitreous, or separate the anterior and posterior capsules. So from the previous slide, removing anterior capsule is capsulotomy. We don't remove the posterior capsule. We don't separate from the vitreous, and the anterior and posterior capsules are already separated. So the hydrodissection is used to separate the lens from the capsule. Let's see the answer. Separate lens from the capsule is the answer. Next MCQ. In extracapsular cataract extraction, anterior capsulotomy is done to make a hole in the anterior capsule, make a hole in the lens, make a hole in the vitreous, make a hole in the posterior capsule, or separate the anterior and posterior capsules. Now remember, the anterior capsulotomy is done to make a hole in the anterior capsule. You can make a hole in the posterior capsule, but that is called posterior capsulotomy and is not usually done. So anterior capsule hole is the answer. Let's see. Making hole in the anterior capsule is the answer. Next MCQ. This stem is almost the same. Look at this one. In extracapsular cataract extraction, irrigation and aspiration is done too. We have just added few more lines in the stem, and that makes it more clinical. A patient has a decreased vision for 10 years with the vision of hand movement. On examination, the lens is turned wide with a normal reacting pupil. In extracapsular cataract extraction, irrigation and aspiration is done too. Remove the anterior capsule, that is capsulotomy. Remove the nucleus, that is lens extraction. Remove the cortex, that may be the answer. Remove the posterior capsule, that is posterior capsulotomy. Remove the vitreous, that is vitrectomy. So remove the cortex of the lens is the answer. Let's see. Remove cortex of the lens is called irrigation and aspiration. Now, before attempting the next MCQs, you need to study the complications of the cataract surgery from the video VHP 9.4, and the complications are divided for the medical professional into complications before the operation, complications during the operation, complications shortly after the operation, and complications long after the operation. You need to remember those lists to answer the questions. Next MCQ. A patient had routine extracapsular cataract extraction. On the first post-op day, the patient has blood in the anterior chamber. It is called edema, hyphema, inflammation, infection, or opacification. Edema is collection of water, hyphema is collection of blood, inflammation is collection of inflammatory cells, infection is pus or infected with the bacteria, and opacification is opacification of the posterior capsule. So hyphema is collection of blood in the anterior chamber. Let's see the answer. Hyphema is the answer. Next MCQ. A patient had a routine cataract extraction. On the first post-op day has the blood in the anterior chamber. It mostly, so it's a blood in the anterior chamber, so it's a hyphema. It mostly needs surgery, needs laser treatment, needs systemic steroids, needs removal of the implant, resolves in few days. So the most probable answer is most of the hyphemas resolved in few days, and very few need surgery, and none of them need laser treatment or systemic steroids or removal of the implant. So resolves in few days is the answer. Resolves in few days is the answer. Next MCQ. A patient had routine extracapsular cataract extraction. On the third post-operative day, the patient develops endophthalmitis. Endophthalmitis is, so what is endophthalmitis? Blood in the eye, inflammation in the eye, infection in the eye, opaque implant in the eye, or residual viscoelastic in the eye. Blood in the eye is hyphema, inflammation in the eye is uveitis, infection in the eye is endophthalmitis, so that would be the answer. Infection in the eye is the answer. A patient had routine extracapsular cataract extraction. Patient had peribulbar hemorrhage, which is early postoperative complication, intraoperative complication, late postoperative complication. It's not a complication, it's a preoperative complication. If you have watched the video, you would know that the peribulbar hemorrhage is because of the local anesthesia, and that happens before the operation. So preoperative complication is the answer. Let's see. Preoperative complication is the answer. Next MCQ. A patient had routine extracapsular cataract extraction. Patient had striate keratitis, which is early postoperative complication, intraoperative, late postoperative, not a complication, or preoperative. Striate keratitis is whitening of the cornea because of the difficult surgery, and you usually see it on the very first post-op day. So it is an early postoperative complication. Let's see. Early postoperative complication is the answer. Thank you very much for being with me, and please do visit youtube.com/@Professor Dr. Mahfooz 7544 for more videos, and please do give your feedback. Thank you.